Mrs. Hill. How are you feeling now?
I'm still not able to accept the fact that I'm having this condition.
That's natural. Anyone, at your age would have the similar concerns. But would you like to talk more about your concerns? Exactly what?
More surprising is like no one in my family has got this condition. Then why me?
That's absolutely a valid question. But let me explain it to you that family history can be one of the reasons getting cancer. But there could be other reasons like changes in the hormones, excessive stress in your life, or the kind of lifestyle we are living where we are exposed to dangerous chemicals day in and day out. So these can be some of the reasons why somebody can get cancer. But in your case, the good part is we were able to detect it early, right? And the surgeon has already performed the surgery, has taken out the cancerous part. So at this stage, I think we should focus more on how we can help you come out of this situation rather than thinking about why it happened. I hope you are getting my point.
But what would happen to my children if I die?
See, again, cancer is a scary disease, and most of the people think cancer means death. But let me reassure you that breast cancer is considered to be the safest form of cancer, provided that it is detected early, and in your case it was detected early. So I have seen a lot of patients recovering completely and living completely normal life after having surgery. Rest assured, Miss Hill, don't worry about death at all. You are going to be absolutely fine, and you will be able to look after your children as well. It is just that right now, for a few months, we will be supporting your children in some way or the other so that you can focus on your recovery.
Gosh, I'm already sick and I don't know, having chemo would make me more terrible and maybe I'm prone to more side effects. How about that?
You're right. We are planning that after operation we might go ahead with chemotherapy or radiation therapy. We are not sure as yet. We are going to arrange your appointment with the oncologist, and oncologist will be the right person to decide whether you would be needing chemotherapy or radiation therapy or not. But regarding your concerns, you're right, chemotherapy has some very unpleasant side effects. Are you aware of any of the side effects of chemotherapy?
I'm totally clueless at this moment. Could you please help me?
Yeah, so I'm sure you might be aware about the hair loss most people have after chemotherapy. They lose their hair, that's the most common side effect. And other side effects may include losing your appetite, having some nausea, vomiting, and weakness. Now, of course, these side effects will be there, I'm afraid, but there are ways to manage these side effects. And the benefits of chemotherapy outweigh the side effects. Taking chemotherapy would mean that you're completely out of the risk of developing cancer once again. And it would mean that the cancer doesn't spread to any of other body parts. Okay? So, what do you think about chemotherapy now when you look at the benefits that you're going to get?
I'm totally in shock. I don't know what to react on this, but I don't know whether I'll be, coming out of this also.
Definitely, like we have some of the ways in handling the side effects as well. Like we can give you some medications to deal with the side effects. Secondly, we can refer you to a dietitian who will be helping you with your loss of appetite and nausea, vomiting, how to deal with that. And then there are a couple of support groups through which we can help you overcome this condition. So,
okay.
Yeah, would you like to explore those possibilities further?
I truly appreciate your efforts on helping me knowing everything.
Okay.
So you could please help me connect.
Yeah. So these are basically breast cancer support group.
Mhm.
These group has members, or the members of this group are people who had cancer before, and they were able to survive cancer.
Oh, I
So
see.
yeah, so meeting these people will give you that ray of hope,
Mhm.
that they had cancer once and now they are living a completely normal life. Another benefit of joining such a support group would be that you would be getting someone to vent out your feelings, somebody who can understand what you are going through, right? Because both of you have gone through the same phase, so you would be getting that emotional support and some positivity about your condition.
Sure, doctor.
So should I, ask the breast cancer support group people to approach you and get you into the group?
Sure, if you find it really important and it would
Yeah.
make a difference.
Definitely,
Please.
it would help you to now think and focus on your future, and stop thinking too much negative about it. As I said, the possibility of recurrence will be less once you complete your chemotherapy, and there are very high chances that you will be living a completely normal life after this.
Thank you, doctor.